Right, let's start with a quick one. I'll try to be very, very quick, although the slides are a few. You might recall this slide from openIMIS, which we have like in one or the other form used from the beginning to explain what openIMIS does and like the functionality, if you read in the details, is being described in a very generic way. And we find it harder and harder to really like specify and explain in a meaningful way to people what openIMIS is actually doing. We're doing social protection, we're doing health insurance, and many other things now. And from this other slide that we normally show in introduction, you can also see that the community and the implementation have become bigger and more complex. And so the challenge for us now is really trying to get complex things, complex scenarios somehow wrapped into something that we can explain and let people play around with. And one complicated topic is interoperability. So let me start with like showing you the complexity of the openIMIS modules, and this is only a broad overview. There are many more detailed code blocks and functionality blocks that play a role in openIMIS, which is difficult for people to grasp. And that's why on the one side, we have started talking about solutions. So we are looking at a solution for health insurance. We are looking at a solution for social cash transfer, and a few others. And on the other side, we are looking at interoperability scenarios between those solutions, like openIMIS in different roles in a health system or in a social protection system, um, and the ways that openIMIS interoperate with other systems. For example, if you look at this typical health infrastructure that you might find in countries, openIMIS could play a role as the financial and insurance management system, could also play the role as a gateway for like hospital and beneficiaries to manage their health insurance and to check eligibility. And what we want to explore is basically the interoperability that openIMIS has with other systems in place. So for example, in Ghana, you have like medical record systems sending e-claims to openIMIS, and then openIMIS sending payment notifications to bank accounts or mobile money providers, and they are also managing contributions from mobile money providers, and you have a lot of connection to other systems in that ecosystem. And the problem for us is always we can explain it to people, we can show you graphics like this, but you still don't really get a feeling of what that actually means. And we need to be more practical about it and more playful to explain to people what that actually means in praxis. So the same we have in social protection. You have openIMIS in several roles in a digital health, a digital ecosystem for social protection programs, and they also have interoperability scenarios. It can get quite complex, and what we are showcasing today is a project on interoperability, the interoperability sandbox, where we have a few chosen products from health and from the social protection scenario. Today we are just looking at the health one, like openMRS and Odoo as a record system and financial management system, sending claims to openIMIS as a health insurance system. It comes from the interoperability sandbox project. If you want to follow up on their current activities, then please follow this link. It leads to the wiki where you find like an updated chart of like the different interoperability scenarios that they are working on. Thank you so much for this. I have talked a lot again, and now you will find a very nice example in practical ways, and hopefully with this, you will get a better understanding of what we are actually talking about. Thank you.
Thanks a lot, Uwe. Then I think that sets the frame nicely. And yeah, handing over to Maxime and Sunil.
Yeah, thank you, Uwe. Thank you, Constance. Hi, everyone, again. So, like Uwe mentioned, we will try to show you what we are building on the Sandbox Setup project on a more practical way and in a very specific sandbox project we are running with Sunil. So the focus here is to streamline the healthcare delivery and the insurance claim, and it means, like Uwe mentioned, to interoperate, to make a link between the healthcare delivery on the field and the insurance claims that you know in openIMIS. So I will try to, follow this small agenda. I will try to make it simple. And I will begin with the challenge, the solution we provided, what kind of benefit we can expect for the different stakeholders, and the standards we built the system on. At the end of the simple presentation, Sunil will continue to demonstrate exactly what's happening and how is it running on the different system. So on the challenge we are trying to solve here, we know in implementation that there is a lot of pain points on the claim registering on openIMIS. Most of the work is done by health provider, healthcare workers, especially, that are usually running claims on paper, and they are creating claim on papers and then save it again in openIMIS. And so, yeah, that spent hours on these kind of activities. Again, the reimbursement decisions and the reimbursement process is very slow, because first they need to do paperwork and then save it to openIMIS and then follow the openIMIS review process, etc. So that can create some delay from weeks to days to years from some countries, unfortunately. And so this is the kind of pain point that we have. Basically, the insurance scheme is struggling as well, because the claims are always asynchronous. So it means that a health facility can claim for a care provided a few weeks, few months ago, and that increase the potential fraud related to those claims. Obviously, the manual data entry can create errors and so rejected claims, because data clerks on the health facilities will probably do some errors if they are entering a claim after a few weeks, few months. And obviously, there is no real-time visibility for service providing and the delivery and the cost related. So that's the main challenge that we are trying to solve with this kind of interoperability. So the question is, how can the countries move from the patient care to payment seamlessly without so much effort and without asking an army of data clerks that will enter the different claims in the system? And in order to do that, we build an interoperability, and this interoperability purpose is to connect the hospital system, the hospital information system, to the insurance management system. And so the first step is the patient visit, obviously. So the doctor or the health worker will treat the patient in Bahmni. We'll try to present what is Bahmni just after. And the data is captured automatically, and the service is recorded in Bahmni, sent to the next step, which is the Odoo, and then it will be synchronized to openIMIS directly. That's a synchronous and automatic system that will be able to send data from Bahmni to openIMIS to generate the insurance claim. The next point is the automated processing. So this one, that's on openIMIS side. the validity rule already existing and the review process that you all know in openIMIS site that will make possible to approve and reject those different claims based on the different rules implemented in openIMIS. And so the last step is the feedback, because after the claim processing on openIMIS site, it's possible to send the feedback directly to the hospital information system to explain if the claim is rejected or approved, and so give a real-time feedback directly in the system that the health worker already know. So that's the process, and that's the workflow we try to demonstrate you today. So on the technicalities, I will not take too much time on that, but that's important to explain that the first step is Bahmni, which is the hospital information system. And like I mentioned, it will capture all clinical encounters and all information related to the care provided. Then automatically Bahmni includes Nodoo instance that will be more focused on the invoice process. So the invoicing on the health facility side, and we are passing through an openIMIS mediator. That's really technical, but that's the central point of the interoperability for different systems. And that's provide some services for the audit trails and the monitoring, especially, and to be sure that the data integrity is respected. So yeah, that's a very technical point, but that's important in an interoperability process at national scales. And the last but not least is obviously openIMIS, which receive the claims on this site and complete the process that you all know. So validate patient coverage and validate the different rules, the automatic rules already implemented in openIMIS, and then approves or reject and give a feedback to Odoo. In order for the health facility to have a feedback directly in their own system. So that's the technical stack. I will not go into lots of detail, but that's almost the different steps that we will try to follow here. So what are the benefits for the different stakeholders? For healthcare workers, obviously, they will stop working on paper-based, and so they will be able to focus more on patient care. They will not have to enter the data on registries, or I don't know which kind of paper they use on the field, and then save it again on openIMIS. So we will remove the duplication of data entry, and obviously the administrative burden is reduced. For the patients, basically, we can have, depending on the implementation, but we can have a confirmation at the point of care almost immediately. And that will, again, depending on the implementation, faster the reimbursement process, because yeah, you don't have to wait for the data clerk entering data after 2 months. Now you have a feedback almost immediately, and if you reimbursed even the patient, that's possible to do so in a very fast way. So that's for the patients. And for the insurance scheme, obviously the visibility in real time is very important, because you can track on real time, and you don't have to push or to wait for the different health workers to make their work. And forecasting will be better, and obviously that will reduce the operational cost, because all claims are saved just once in the hospital information system. And for the Ministry of Health, because that's the kind of challenge they have as well, having those kind of real-time system and those reactivity can add major decisions and data-driven decision, and reduce probably the cost of duplication. So yeah, for the different stakeholders, that can be interesting to have this kind of interoperability. obviously, to build that, Uwe mentioned that in his presentation, but we try to follow different standards. Lots of them are already existing in openIMIS out of the box. So we are trying to follow the openHIE architecture. We are following FHIR standards that was already existing in openIMIS, and we are using an openIM middleware to make the interoperability possible. And so the system is more adaptable because basically you can adapt this kind of interoperability for different kind of contexts. I think that in Nepal they already implemented it. In Cameroon they plan to do it, and basically all those solutions are based on open source solution. And so without so much effort, you can adapt those solutions in any kind of context, any kind of countries. So yeah, there is multiple healthcare contexts that you can cover with this kind of implementation of integration, because that's really flexible on each stack on the technical side. Okay, so I will give the floor to Sunil just to showcase, to explain what we achieved, what he especially achieved in this interoperability. Like I explained, we'll begin probably with Bahmni, like you can say, and Bahmni, Odoo, and openIMIS at the end of the process. Thank you. Over to you, Sunil.
Maybe you can see my screen. I just want confirmation.
Yeah, we can see it. Yeah.
Okay. Thanks, Maxime, for your comprehensive explanation. So I'll just start with the demo, and the first screen is the Bahmni, and the Bahmni is the complex medical record system that is paired with openIMIS as well. So the backend is openIMIS, while we are seeing the Bahmni screen. So first of all, the health workers will probably, maybe the hospital worker will probably would log into the system. So like this, they will just choose the location. So the first step is the registration of the patient. If they have the insurance card, they will probably show the insurance number. So the patient name will be like Anna, for example, and then the basic information of the patient would be given as in registration, and this serves at the purpose of the National Health Insurance ID that everyone carries in Nepal, and probably is the same in other countries as well. So they probably show the card to the hospital management recipient, and they probably record the insurance number like this. Once they fill the information, the basic information, then they start the visit, like the OPD visit. These are the bunch of information that anyone can record in the system. So these are the information that provided by the Bahmni. Then after, we need to go to clinical, where the information like the lab or the radiology is there. For an example, once we register the patient, they pop on the screen of the Bahmni like this. So I think there's a bunch of information that is recorded in openIMIS, which are quite irrelevant to us, but you can just see there's information of the lab condition, those kind of thing in the openIMIS or Bahmni. So just go to the consultation to make our demo more flexible, so that what we are doing. So once the patient is there, and let's say there's a scenario where the hospital wants him to do the test and lab orders. For example, the blood test sample, he can order from the Bahmni. So as you can see, this screen is the orders. Orders means whatever the doctor prescribed to the patient, they would just put that in their tab. So when they when there is a orders from the maybe probably the lab radiology, then they just select whatever there is available in their system, like the services or items. For example, I'll just do for the CBC. Say these are all service provided the openIMIS, but we are not going to do everything as of now. So we just use the complete plot count and then maybe the clotting time test for an example. So we just save the information on this patient. So basically the patient ordered two kind of services like the CBC and clotting time test. Now, whatever you are seeing in this screen is data collection from the patient with his insurance number that is relevant to the openIMIS for the linking and the service and item. So now I'm going to the Udo because as Maxime previously mentioned that the information captured in the Bahmni or Bahmni or openIMIS is kind of synced with the Udo, creating the bills or the billing system that is required for the openIMIS to process. I'll just go with the Udo. So I just go to the insurance tab. Okay, now you can see this data coming from the Bahmni to the Udo. And the real purpose of doing this kind of thing in between the system, in between two systems, is that the current Bahmni that we install as an instance doesn't really provide any kind of billing system out of the box. So we are pairing these with the Udo because Udo itself has a capability of adding the bills or maybe some kind of billing system in their own. So we are just using the Udo for the reference. So as you can see, you can just see the insuri there written. And as you can see, this screen is really meant for the either for the demonstration or maybe even the real life example where the some of the hospital in Nepal are doing the thing from the Udo itself. So we just put some basic information like the start date when the patient came to the hospital and then when he walked away from the hospital. So these are the dates required for the openIMIS as in file standard as well. So we just fill the basic information. Now, one of the tricky part of the openIMIS claiming is, as you can see, there is the CBC and clotting time test in the product tab in the column because there's a IMIS service and item code in the next column, as because the code and the service item should be equally compatible with openIMIS. So we need to map this item and service so that the openIMIS can understand whatever they are sending from the hospital side. So let's say I just put that general consultation, which doesn't seem but for the demo, I just put general consultation as in CBC and then the clotting to the breast abdomen. So we can just say the price of the service to the patient. So let's say I just put 200 over there, and you can just see 650 as in total to the ENA blown. And I also need to add the diagnosis because the diagnosis was not carried over from the openIMIS, and we need to put the diagnosis coding here so that openIMIS would know exactly the ICD code, whatever the ICD code the hospital are sending through the interoperability. I just select one of those ICD codes. Now, I think everything is settled here, the information and everything, and we still need to add attachment of a sample attachment, how the billing system from Nepal. Let's say I'll just keep the example from Nepal. They need to provide the validation from the doctors, like they have some kind of diagnosis that they need to provide as a proof for the claiming. So I'll just confirm the claim. So the claim has been confirmed, and let's say I'll just add the attachment after confirming. For example, I'll just attach one of the dummy bill in this side. So I think everything is set up, and then I just sense the claim. So in this screen, you can see there's a claim code named Bhela, Bhela test 8. So that's the reference number that we showing the claim status in openIMIS later on. So just moving with the flow. Now it's sending the claim to the openIMIS through the openHIM mediator. So it just passed from the openHIM mediator, and then after it's passed, it goes to openIMIS. So like Maxime previously mentioned, the openHIM is a middleware where it grabs the data of the transaction data, whatever the health insurance hospital sends the data from their end would be logged in this system as in middleware, and then it goes to the openIMIS. So as you can see, the claim post, the first row is successful. You can just see there's a bunch of information in the openHIM, bunch of information like whatever the hospital is sending. You can just see there's a request body. It's in the FHIR standard, and that thing is logged. And then there's a response body. Whatever the content in the response is, this uh, would be from the openIMIS itself. So openIMIS already provides the response, whatever the claim has been saved or not. This kind of information is in the response body. So you can just see these are the logs. I just need to open our sandbox openIMIS. So sandbox openIMIS is up and running. I'll just put the claim management section, and we'll type the Bhela test that I previously mentioned. This is the key point for us to know what the claim and where the claim is at. Let's say I just search the Bhela, and you can see there's a 2, but we are sure that we are using the 8.1 right now. And you can see there's a 1 claim attachment in the system. And based on the openIMIS validation, it's been rejected probably because of some reason, but it's not quite important right now. I'll also explain the situation of how the things work in Nepal. Let's say I open the claim. Whatever I mapped in the Odoo form, the services that they are in the screen, like A1 general consultation, and then there's breast abdomen. So you can see the attachment there, and you can even see the whatever the bill from the hospital side. So this is the very sample bill that I attached in the claim management system, but there could be multiple, like it could be like maybe 10 or 20, depending upon the diagnosis or the prescription of the patient in the hospital. So I think that's it from our side.